Hi everyone, welcome to our first video lecture, What is Evidence-Based Practice? I will be your host, Samantha Kelvin. Okay, so our outline and objectives for today are to discuss what is evidence-based practice, or EBP, the definition, the origins, what it's not, the importance of it, and criticisms. So what is evidence-based practice? So initially it was pioneered by Professor David Sackett and colleagues, and he basically said that EBP is our attempt to find the best available research to assist health professionals to make the best decisions possible. So really, the core purpose of it is to assist in making clinical decisions. So what do we mean by evidence? What counts as evidence? So in the context of EBP, evidence is derived from research evidence. It's important that we realize it's not just evidence or research, but it's actually finding the best evidence. The philosophy of EBP really involves the integration of the best research evidence with clinical expertise. And then we also enter into a third realm where we include the patient's unique values and circumstances. So we're not solely focused on the clinician's experience, we're not solely focused on the best evidence. We also want to know what the patient believes and values. It's also important to recognize that there's a larger context going on here. So what's the context of the patient scenario? In regards to maybe health insurance, living conditions, things like that we need to take into consideration. So this graph basically depicts that coming together of all four pieces. So briefly, the historical origins of it. It was brought about from a medical school in Canada. Physicians there thought that people should develop skills for lifelong learning. So before EBP, we relied historically on the experience that clinicians had, and basically that experience and lessons learned would just be passed down. But this is problematic because some information might be biased or out of date. Just because it's done one way one time and it worked doesn't mean that can just be solely passed down as the way to do something for the rest of the time. So evidence-based practice is not just clinical guidelines, it's not just randomized control trials, it's not just looking at the evidence, but it's really that we're looking at all of those pieces together. And this course focuses on that evidence piece of it, but it's important to realize that it's really all four pieces coming together. So why is it important? It's important because it helps us have more effective care for our patients, and maybe not just patients. Maybe you're a community health major and you want to find evidence for a food bank program in an underserved area. So you can think of it in terms of that kind of scope as well. We want to improve patient outcomes, we want to improve the community, we want professional accountability, we want to efficiently use our time and minimize wastage. We want to make sure that we're using healthcare resources appropriately, and then this can really influence policy and decision making in hospitals as well. So there are a few criticisms of evidence-based practice. Some might say that it relies too heavily on quantitative research, but we recognize that the role of qualitative research is also really important. There's a limited availability of some research, so that can be taken into consideration. And then the professional practice evolves really quickly, and so again, we need to make sure that expertise point of view is included in. And also just the nature of evidence. There's knowledge-based, information-based, and evidence is always changing, and so in order to keep up with it, we have to keep current. This is all for our first mini lecture. Stay tuned for the next one, and have a good rest of your day.